Thank you, Madam Speaker. We have several of my colleagues here to join us. We will just continue the discussion that we had before. I think I'll move to the other, so I have the easel available to me. If Ms. Jan Schacowsky will come up and join us, Mr. Ellison will carry on. I see Mr. Tonkin is now in the chair, but we've got things we want to talk about here. Let's just continue this discussion that we had a few moments ago. Our friend on the Republican side is either late or decided it wasn't worth continuing to discuss their position. We were covering the Medicare issues here in some detail over the last hour, and there's some of that we want to continue and make sure that people understand what's happened in Medicare. We want to also talk about the rest of America. Those that are not yet 65 or will not soon be 65, will go through those issues. I want to just start off by laying out what's happening here in Congress. I'm a newbie. I haven't been around all that long, and I'm going, wow, how's this all work? And as I've watched it, I've listened to what our Republican colleagues talk about ramming through this legislation, and I'm going, gee, I was the lieutenant governor in California until November the 5th when I was sworn in here. And as near as I can recall, this debate started 14 months ago. It was the president standing right there in the well here, giving his State of the wasn't State of the Union at the time, his first speech to the House, and he said, "We have got to reform the health care system." And immediately, this House and the Senate took up the issue, debated it. We all listened to that debate all year long. It went on and on and on and on and on and on, and it was my good fortune, following my November 3rd election, to come back here and on November the 6th, be one of the people that were able to put before Americans this House, the Democratic version of health care reform. And it was Christmas Eve that the Senate finished their work and put that out on a 60 vote, not a simple majority, but on a 60 vote bill. So now you got both houses having completed their work and doing what has been the tradition of Congress since the very inception of our government, more than 200 years, doing the conference work, putting together the House and the Senate versions and finding the compromise between the two of them. And the mechanism that's going to be used is a majority vote of both houses, 51 in the Senate and 200, and I think it's 16 now, which some of our members have retired, to pass an extraordinary important piece of legislation. So the process is not jammed down anybody's throat. This has been debated more than most bills will ever be debated, and the debate actually goes back to the turn of the 20th century. It's been here for a long time. So we're moving as we should in a way of openness. It was the president who had his health care summit 7 hours on television. Never happened before. Discussing all the issues, Republican ideas, many of which are going to be in the final rescission vote that we'll take up this week. So this is not ramming anything through. This is a very deliberative process. It's gone on for a long time. So I want the public to understand that. I want them to understand that as somebody that watched it from the outside and now somebody that's watching it from the inside, this is an extraordinarily open public debate that's gone on for 14 months this session, and this issue's been around for a long, long time, decades.